Hello there, my name is Lauren and I'm going to be teaching you how to give a subcutaneous injection for heparin. All right, so we are going to do our first med checks. So we are going to hand hygiene in. And so we are going to do our first med check. So right patient, Chris Johnson, right date of birth, January 10th, known allergies to any medications. All right medication, heparin, right dosage, 5,000 units per milliliter, and we need 10,000 units, so it'll be per 2 milliliters. All right, and then right route, subcutaneous injection, right route, and then this will be once a day at 9 a.m., right timing, right indication. Heparin is a blood thinner, and there's no expiration on this. It will be documented by bedside once completed. All right, so what I'm gonna do is I'm going to be using a 25 gauge needle. I'll be using a 3 milliliter syringe and then a blunt fill needle. All right, so first I am going to clean my file. All right, so we're gonna clean this for 15 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. All right, now that I cleaned that, I am going to get my stuff ready. All right, open this up, and then I'm gonna leave this on the table. Open up my blunt fill needle. Make sure you keep asepsis technique. We don't wanna have anything touch. All right. All right, so what we need is 10,000 units, which is 2 milliliters. So we are gonna aspirate up to 2 milliliters. And then we are going to stabilize, inject, push down, pull back up. And we're gonna pull up a little bit more than what we need, just so we can make sure we got the correct dosage. All right, hand behind back. Scoop technique, perfect. All right, now we're gonna get rid of the air bubbles in here and the extra liquid we have in here. Make sure we have 2 milliliters. There we go. Perfect. All right, so we have that. And now what we're gonna do is we're gonna put that down. We're gonna open up our needle, 25 gauge needle. We're gonna screw this off, put it on our needle, put that down, get rid of our needle. All right, and now we are going to label our heparin. So for labeling, patient's initials, medication, dosage, and you can put route if you would like. So we have Chris Johnson, and then this is gonna be heparin, and then this is gonna be sub-Q, and then this is 10,000 units per 2 milliliters. Okay. All right. And now I'm going to put this around my cap. All right, so it should look like this. All right, now I'm gonna do my second med check. All right, right patient, Chris Johnson, right date of birth, January 10th, no known allergies to any medications. All right, perfect. We have right medication, heparin. We have 5,000 units, right dosage. It will be 10,000 units per 2 milliliters. All right, right route, subcutaneous injection, right route. This is gonna be once a day at 9 a.m., right timing, right indication. This is a blood thinner. There's no expiration on this, and it will be documented by bedside once completed. All right, and then we are going to hand hygiene out. And then we are going to go to our table with our patient. All right, and then now I'm going to interact with the patient. Hello, Mr. Johnson, my name is Lauren. I am going to be your nurse today. I just need to confirm your name, date of birth, and any known allergies to any medications. All right, Chris Johnson, date of birth January 10th, no known allergies and medications. All right, perfect. All right, Mr. Johnson, today I'm going to be giving you your medication. This is Heparin. It is a subcutaneous injection, and this is a blood thinner. I'm going to be giving it to you in your abdomen. It'll be right next to your umbilicus above the iliac crest. All right, and then what I'm going to do first is I am going to do my third med check and my final med check. So we have right patient, Chris Johnson, right date of birth, January 10th, perfect, no known allergies, other medications, none, just confirmed with him. All right, and then we're gonna do right medication, heparin, right dosage, 5,000 units per milliliter, so we need 10,000 units, so it'll be per 2 milliliters. All right, right route, subcutaneous injection, right route, and then this is going to be at a 45-degree angle. And then this is going to be once a day at 9 a.m., right timing. And then this indication is for a blood thinner. There is no expiration on this, and it will be documented by bedside once completed. All right, so now I'm going to put on my gloves. All right, I'm going to clean the skin, and I already indicated I'm going to be giving it in the abdomen, 3 inches from the umbilicus. So we're going to clean the skin for 15 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. All right, perfect, gonna let that dry. And then also before you give your injection, you wanna assess the skin. So there are no lesions, no discoloration, there is no redness. Do you feel any pain or tenderness, Mr. Johnson? He responds with no, okay, perfect. And then now what I'm gonna do is, since that is dry, with a subcutaneous injection, you wanna pinch the skin, and then we are going to administer the medication at a 45-degree angle. All right, so what I'm gonna do is I am going to pinch the skin. We are going to administer at a 45-degree angle. 1, 2, and always with the bevel up. 1, 2, 3. All right, and then now I'm going to inject. And then make sure with subcutaneous you do not aspirate, because we are not going into an artery or near any arteries. All right, perfect. Now I'm gonna take my hand away, take this out, safety lock it, dispose of it, and I'm gonna observe the skin again and assess. There is no swelling, there is no inflammation, discoloration, or lesions. Mr. Johnson, do you feel any pain or tenderness? He responds with no. Okay, perfect. So I'm going to document that I gave this medication accurately and efficiently. And now what I am going to do is I am going to take my gloves off. And then I am going to lower the bed all the way to the lowest setting, both side rails up, and then call light is within reach and bed is locked. All right, and just hand hygiene just for precautions. All right, Mr. Johnson, you are all set for your blood thinner injection of heparin 2 milliliters per 10,000 units. We will see you next time for your next injection. Please let us know if you need anything, utilize that call light, and you're all set. All right, we will see you next time. Have a great day. And hand hygiene out. And that is how you give a subcutaneous injection of heparin. And there you go.